I had an opportunity to receive this book, I think it should be 20 years ago. I don't know how it came into my hands, but I think it was through my first associates with the project, because the first donors whom I took over the project were the two Americans, Mark and Delia Owens, who were doing some work, and they had started a rural health program in communities where we had no clinics, no health assistants. And when I continued this program, I didn't have any support from anyone else. But this book gave me the power and the tools. So we used this book mostly for reference and for reading and for help in terms of things like the rural health sanitations and how to take care of their environment. I think this book helped us a lot, and I think this one was one book which I think it had an impact on my work. It was through this book that the National Geographic had to find me out into the bush because of the work which they captured with the women I was working with. And I think when people heard about what I was doing, the thought of again sending more materials which were quite helpful. So as someone who has been associated with the rural health programs, I've found this book to be very, very, very handy and helpful. It is simple. We are able to read, we are able to interpret, and it's very basic, and it doesn't need someone to be a doctor to understand it. I've got a background of an agriculturist turned into a conservationist, but this book easily meshed into my career path, and also it worked very well with the rural women. And also the illustrative pictures, the drawings which are in there, they are very, very elaborate and quite easy to understand. So I think this is a book which still has a big space in Africa, where literature is not easily available. But this handbook can't only be used by one person, but it can be used by the entire community. And I had an opportunity to share it with one community, and everyone would just come around, children, elders, and just look at pictures, and that motivated them even to understand our health messages. So to me, I've really valued this book so much.